Dr. Hiranya S, a resident physician and currently based in Los Angeles. Born and raised in Singapore, she graduated with her MD from St. George's University and completed her clinical rotations in Europe. Beyond her professional pursuits, she is the founder of Hiranya Medical Service, a non-profit organization based in Singapore that actively supports global social services. Please join me in welcoming the dynamic and compassionate Dr. Hiranya S.
Good evening, everyone. First of all, I would like to thank the Tamil organizations, and most importantly, special thanks to my dear uncle, Dr. Chokkalingam. We are very close family friends, and I'm so blessed to have his guidance throughout and for him being a wonderful mentor towards me. So just a brief background, I'm currently doing my residency in family medicine, and I'm in my first year, so I just recently started, and today I will be giving a talk on preventive medicine. As Uncle said, prevention is better than cure, so just a brief talk about that. Okay, so whenever you go to your general doctor and so when you go to your general doctor, they tell you you're scheduled for a well adult exam or an annual visit. That means they expect you to come every year. Once you're done with the session, they'll be like, okay, please follow up for the next year and schedule in the front, right? So what is this exam about? This exam is done just so that we can find out if there are any problems going on. Are your organs functioning properly? Are there any problems in your body in terms of like anemia, thyroid disease, and so on. So they're going to do a lot of blood draws and check the levels in the body. They will also do like a routine physical exam to check your different organs. And they also do encourage people to take vaccinations and do routine screening for different types of diseases and cancers. Right? So usually they suggest that this is once a year. However, guidelines show that if you're 49 years old and younger and you're healthy, it's enough if you do this examination once in 3 years. And if you're 49 and younger and you have a medical condition, let's say diabetes or thyroid or high cholesterol, then we recommend doing this once a year. And if you're 50 and above, since elder people are more prone to like diseases and so on, we recommend doing this once a year. So let's talk about vaccines. Why are vaccines important? Vaccines are important because it can provide the immunity to your body in case in the future you get any disease you catch hold of, let's say a flu, your body is more ready to fight away that. And even if you catch that, the complications are much lesser. So we encourage people to take vaccines to prevent yourself from getting that as well as prevent the spread of the disease. So there's something called herd immunity, which means, let's say you're in a population where there are 100 people and 90 of them are vaccinated and 10 of them are not vaccinated for several reasons. It could be like younger people or older people who are immunocompromised with cancer and so on, they cannot get vaccinated. So let's say those 10 people are not vaccinated. These 90 people who are vaccinated will be able to decrease the spread of the disease by protecting those who are not vaccinated. So this is called herd immunity, and this is the importance why we recommend the entire society to get the vaccine. So these are the different types of vaccines that we recommend for both adults, male and female. I'm not going to go too much into depth, but just a brief overview. So we have the flu vaccine, which protects you from the flu. We recommend it once a year and usually taken before the flu season. So we're almost in the flu season right now. So if you've not taken your shot, you should probably go and visit your doctor for a shot or in the pharmacy. And it takes around 2 to 3 weeks for you to build up the immunity. So it's better to take it before the flu season starts. The next one is Tdap, tetanus, diphtheria, acellular pertussis. This vaccination protects you from potentially life-threatening diseases such as tetanus. Tetanus is like a disease where your muscle gets stiffened because when you have a cut in your skin or a wound, this particular microorganism can go and it can affect your body and cause that condition. Diphtheria and pertussis are transmitted through respiratory droplets, so like when you're talking to someone or when you're sneezing. And diphtheria particularly affects like your throat, makes it difficult for you to breathe, and sometimes even causes paralysis. Pertussis is like a whooping kind of cough that is common and is very life-threatening, especially in babies less than 12 months. So in order to prevent these conditions, it is recommended to take 1 dose of Tdap vaccine, followed by a booster of only tetanus and diphtheria every 10 years. The next vaccine is shingles. This is caused by a virus that causes also chickenpox. And shingles is a condition where you have painful blisters, red blisters on one side of the body. So to prevent that, we suggest the shingles vaccine, especially after the age of 50, 2 doses of that. The next one is pneumococcal vaccine. It's given after the age of 50, and this prevents from pneumonia. And the next one is HPV, human papilloma virus vaccine. So human papilloma virus is a particular virus that is transmitted through sexual activity. Vaccination, you can give 2 doses if you're vaccinating them between the age of 9 and 14, and if between 15 and 45, you give 3 doses of this vaccine. And this particular vaccine is very important because if you're infected with, say, HPV, it increases the risk of cervical cancer, which we do not want, right? The next one is meningococcal vaccine, and this vaccine is given to prevent the condition called meningitis, which affects your brain. So these are the different types of vaccines you can take. So now we're just going to talk about different types of diseases, including cancer, and what are the different risk factors behind it. So if it's a risk factor, then you can understand that, okay, that's what you're supposed to decrease. Let's say smoking is a risk factor, then cut off smoking, for example. So let's look at the different risk factors for the diseases and what are the routine screening tests that we can do to prevent this. Right, so cervical cancer, most common risk factor is smoking, as well as getting infected with a sexually transmitted disease called HPV, as well as having a genetic connection and having multiple full-term pregnancies and long-term use of birth control pills. So what can we do for routine screening? You can go to the doctor or you can do this at home. It's a pap smear or a HPV test, and this is usually done in females who only have a cervix. So let's say some of the females have like uterus removal and so on. When they remove the uterus, they also remove the cervix together. So when cervix is removed, you don't need to do this test. It's only for females who have cervix. What will this test do? It is going to detect the abnormal cells in your cervix that can be precancerous in nature. And by finding out these cells, you can treat them earlier and prevent cancer. Right? So what is the age recommendation for this? If you're between the age of 21 to 29, you can do a pap smear every 3 years. If you're between the age of 30 to 65, we do a pap smear every 3 years, or HPV testing every 5 years, or HPV and pap smear every 5 years. If you're greater than 65, we usually do not test for this particular condition until and unless in the past you had a positive screening test. So you can do it at home self, like on the left side where you see you use a cotton kind of brush to swab. It just gives you more autonomy and more comfortable to do it at home. Or you can go to the doctor, which is the most traditional things that most patients do, and they will place like an instrument through the vagina and then put a swab and take the cells from the cervix. So this will help them see under the microscope if any of the cells are like mutated and or precancerous. Alright, so going on to the next condition, breast cancer. I'm going to talk more specifically for women. So what are the risk factors? There are uncontrollable risk factors which you really cannot control. It's like demographics or genetics, or the like controllable risk factors which you can control. So managing your diet and exercise and so on. So the uncontrollable risk factors, females are more higher risk compared to males. The age of greater than 40 increases the risk. Genetic factors. If you have a positive family history of breast cancer, you're more likely to get it because of the genetics. A late menopause, so attaining menopause after the age of 55, and exposure to radiation. So a lot of the patients, like they come in with breast cancer, they have a history of, oh, I've always gone to the ER, I needed to get chest x-rays. So getting the chest x-ray can also have radiation exposure towards your breast, which can also increase the risk of breast cancer. Now, let's look at the factors that you can modify and control. Having no children increases the risk of breast cancer. Giving birth at an older age, especially after the age of 35, not breastfeeding increases the risk. Using hormone replacement therapy also increases the risk. and this is particularly in people who are post-menopausal. They have menopausal kind of symptoms, so they want to use hormone therapy. Using hormonal birth control also increases the risk. Eating lots of processed and fatty foods. So the moral of the story that we learned from Uncle's talk was always eat healthy, right? Lack of exercise as well as obesity increase the risk. So how can we ourselves test if we might be prone to it, right? So you want to do a monthly self-breast exam at home. There are different ways to do it. The one I have on the screen is a simple one where you are in an upright position sitting and you take the 3 middle fingers, use the pads, meaning the tips of the 3 middle fingers, and using one hand to support one breast, the opposite hand you use to palpate, right? So use the right hand to palpate on the left breast and vice versa. So you're going to go in a circular motion and you're going to feel first with light pressure, then you repeat it with medium pressure and then again with high pressure. And when you do this, what are you going to look for? Any abnormalities, any lumps are there? Is there any nodularity? Have you noticed any skin changes? Is there any skin thickening? And then also most importantly, you have to look around the areola or the nipple. Is the nipple kind of inverted or is it normal? And when you squeeze the nipple, is it giving any abnormal discharge, like clear liquid or blood and so on? And if you think that something might be wrong, you can always go to the doctor and get it checked out. How do they check it there? At a younger age, they usually do ultrasound, but the routine screening recommendation is mammogram for an older age, which is 40 to 70 years old. What is a mammogram? Mammogram is a particular type of X-ray that is done for the breast, and it detects the abnormal changes in the breast tissue, so like the lumps and others that I mentioned. And by doing this, you can prevent breast cancer by treating it early. So it's done once in 2 years from the age of 40 to 74. And for people who have a family history of breast cancer, or they have like a genetic mutation, specifically BRCA1 or 2, they are advised to do a mammogram, or more specifically ultrasound, below the age of 40. So we're going to talk about abdominal aortic aneurysm next. So what is abdominal aortic aneurysm? In your body you have different blood vessels, right? Aorta, which is a type of artery, or you have the veins and so on. This aorta specifically runs in your abdomen, and the aorta has a wall. The wall should be strong, but if the wall weakens, it can cause dilation of the aorta itself, right? Which increases the risk of a lot of things, including the clots that form in your blood to move elsewhere. So this particular condition has several risk factors. So one of them is increased age, greater than 60 years old. Males are more increased risk for this condition, and if they have a first degree relative with this condition, they're also of increased risk. Those women with hypertension, and most important risk factor is smoking. So how can we reduce this condition? Stop smoking, exactly, stop smoking. Alright, so, sorry. Okay, so what is the routine screening for this? We suggest that males from the age of 65 to 75, if you have ever smoked in your life, get an ultrasound done of the abdomen, and it will detect the diameter of the aorta, if it's enlarged or if it's normal size and so on. And by detecting that, if it's enlarged, depending on the size, they can tell you how the treatment can be done. Alright, so the next topic is about prostate cancer. So prostate cancer common in males because of the increased age, family history, as well as greatest in certain ethnicities, and any prostate changes such as high-grade prostatic intraepithelial neoplasia. That's a very medical term. It basically means that if there are changes to the cell in the prostate that make it precancerous, you can increase the risk of prostate cancer. And diet, most importantly, diet that is high in animal fat and low in fruits and vegetables can increase the risk of prostate cancer. So how can we check for this? You can do a blood test. So from the age of 59 to 69, we want to check for a marker called the prostate specific antigen. And This screening can be done maybe once in a few years, and the frequency would be recommended based on your family history, based on your own medical history and so on. So you can discuss with the doctor how often this should be done. And some of the doctors also do a digital rectal exam. So when you go for your annual visit, the doctors would place their finger in the rectum to feel for the prostate, and if it feels a little bit nodular and so on, they would recommend doing further tests. Alright, the next one is colorectal cancer. So there are several risk factors for this. Being older, so more than 50 years old, usage of alcohol and tobacco, lack of physical exercise, low fiber diet, personal history of inflammatory intestinal conditions like ulcerative colitis, and a family history of colon cancer. So how can we check for this? You can do routine screening. It's for both male and female, and from the age of 50 to 75 years old. However, if you have a family history of colon cancer, it is recommended to do the screening before the age of 50, or if you have a personal history of inflammatory disease such as ulcerative colitis. What are the different methods of screening? So there are 3 methods that I'm going to talk about now that specifically uses the stool sample as a method of testing. So the fecal immunochemical test uses the stool sample, so it is very easy. You just need to go home with the cup that they give you from the hospital, take a stool sample, go and give it back to them, and they are going to put it under a different test to see if it has blood. And it detects blood specifically using antibodies. This is done every year, and if results are positive, they would advise you to do a colonoscopy. We'll further talk about what colonoscopy means. This is also a different type, multi-target stool DNA test with FIT. Specifically over here in the US, it's very commonly called Cologuard. Also uses stool sample, test for blood similarly, and it's done every 3 years. And if positive, once again you do a colonoscopy. The way of checking for the stool is different between these 3 options that I'm talking about. And the third one, once again, tests for the stool sample, detects blood. And this one is called the GOAC-based fecal occult blood test. And if the results are positive, once again you do colonoscopy. It's done every year. Now, coming to colonoscopy that I've been talking about this for so long, colonoscopy is done in the hospital. So the past 3 that I said was non-invasive, you give a stool sample, it's done at home, it's simple. People prefer that because they don't want to be inserted with a tube from the rectum to check the colon. But colonoscopy is the best way in the sense, when you're doing that particular test, they put you under mild sedation. They place a tube with the camera inside your intestines to see if there's any abnormal polyps or cancerous lesions. And if they find anything like that, they will be able to immediately cut it off during the procedure itself. So that is a very useful type of procedure. It's done once in 10 years, as long as the polyps are not cancerous and you need to go in once again. Alright, so this is the second last disease we're going to talk about, lung cancer. What are the risk factors? Occupation. Any occupation that makes you to take in a deep inhalation of harmful substances, right? Smoking, tobacco, secondhand smoke. So if you're at home and then you have someone smoking at home, inhaling that also increases the risk. Family history of lung cancer. Diet we spoke about, increased age. Other lung diseases like COPD, tuberculosis, etc. increases the risk, and exposure to radiation. So how I said if you take a lot of chest x-rays, it increases the risk of breast cancer. Similarly, chest x-rays also increases the risk of lung cancer because your breast and lung are almost in the same region in your upper chest. So what can we do for routine screening? You can do a low-dose CT scan, and this is recommended only in people aged 50 to 80 if you have a 20-pack-year smoking history and you currently smoke or you quit within the past 15 years. What does this detect? As you can see in the image on the right, the CT scan will detect any abnormal nodules or abnormal tissue in your lungs that could suggest cancer. Alright, so the next thing we're going to talk about is osteoporosis. What is osteoporosis? Based on the image that we are seeing there, what do you all think osteoporosis might be?
Brittle bones.
Brittle bones. Excellent. So basically, like you know how your bone should be kind of high density, the bone starts becoming low density. They might be more specifically pores or like holes in your bones, which will increase the fracture risk. So a lot of risk factors for this: low calcium intake, and as Uncle was mentioning, vitamin D deficiency. Estrogen deficiency, more specifically in postmenopausal women, lack of exercise, cigarette smoking, alcohol consumption, and taking certain medications like steroids also increase the risk. So medications, yes, they help you treat your current symptoms, but you know, certain medications like steroids are not recommended to be taken for long term because it can increase your risk of osteoporosis. And also prolonged use of thyroid hormone treatment for thyroid problems. So how can we screen for this for both males and females? We can do a DEXA scan. This scan is going to detect the bone density or the bone strength, especially in your hips as well as your spine. And it can detect if there is certain amount of bone loss, and it can be treated before any fracture occurs. So we usually recommend this in females. It can be done in males in case they have a past history of fracture, and it is done from the age of 65 years and older. So the last one is just very general routine screening that is done in both males and female adults, which is blood work once a year. We check for CBC. CBC means you're going to check if you have anemia, if you have any infection. You check for CMP, so you're checking for the different electrolytes in your body. So sodium, potassium, phosphorus, and all of that. You're also checking for your lipid panel levels, which is your cholesterol. Good cholesterol like HDL, bad cholesterol like triglycerides and LDL. And HbA1c, which is your glucose levels from your past 3 months, STDs, so sexually transmitted diseases, and in some instances, thyroid panel will be done to check your thyroid levels depending on your medical history and family history, and most importantly, vitamin D level. So a lot of the patients have low vitamin D and they don't even know. So when you're in a region where there is lesser exposure towards the sun, let's say like in America, like half of the year is like winter, so you don't get much exposure to the sun, you're more prone to vitamin D deficiency, and we recommend checking for the levels of vitamin D. If it is below 20, then they would recommend you taking vitamin D supplements so that you decrease the risk of fractures and so on. And in general, whenever you go for a well adult visit, they're going to check your check for any high blood pressure. They're going to check if you have anxiety and depression as well. So these are the different references that I taken, the information from the previous slides. I hope this was helpful, and all of you will always stay happy, stay healthy, always be calm, be positive, and get your yearly check done with the doctor, with your PCP, so that we can prevent any disease and keep you all always healthy. Thank you for the opportunity. Yeah, sure. I can share the slides, yeah.
With me, I can share with the community.
To come and get that vaccine, we don't do that. But this was very informative and eye-opening for us. Thank you so much. Appreciate it for coming down here and showing this to us. Big round of applause for her. Small version of her. Thank you so much.
You want to play in the bouquet or the card?
Nibarna?